Hello guys, welcome to Fast Coder 21 Medical Coding YouTube channel. The purpose of the channel is to help the people who are in need of medical coding reliable resources. If you are already subscribed to our channel, help your friends to subscribe. If you are visiting for the first time, then click on subscribe button to receive future updates in medical coding field. This channel is helpful for freshers, experienced coders, aspirants of AAPC certification exams and HEMA certifications exams. If you have any other topics or concerns, please mention in the comment section so that we can make separate sessions for those topics. Please click on like button to encourage and motivate us. Please watch until the end to gain in-depth knowledge about ICD-10 CPT, HICPICS coding system, as these Q&A sessions are very useful in live coding, medical coding interviews, CPC and CCS certification process. If you go to any interviews, keep familiar with the books like ICD-10 CPT, HICPICS, as these sessions will assist in the process of interviews, but not an alternative to interviews. Today we are going to know about the monkeypox. As you know, nowadays like coronavirus, monkeypox is also spreading very fast. So we need to take care of monkeypox, and here we are going to know about monkeypox symptoms. The symptoms of monkeypox are fever, headache, muscle aches and backache, swollen lymph glands, chills, exhaustion, respiratory symptoms, a rash. These are the most common symptoms. You may get other symptoms also. As soon as you find these symptoms, you need to go to the physician and get checkup. So most importantly, AMA has released July CPT assistant about monkeypox vaccination process, and they have released codes to code monkeypox testing. As you know, in US monkeypox is growing very rapidly, so we may code in the future about monkeypox cases. So we need to know about the monkeypox coding procedures also. So if you see here, new monkeypox testing and vaccine codes July update. In response to the emergent nature of public health concerns surrounding monkeypox, the current procedure terminology editorial panel has approved three new codes specific to monkeypox. As you know, in US currently they have imposed health emergency for this monkeypox. So in future we may need to code these codes in our live coding. So the panel approved one code 87593 to report the laboratory diagnostic testing for the orthopox virus, and two new code vaccine product source 90611 90622 for the smallpox and monkeypox combined vaccine and the traditional smallpox vaccine respectively. See here one important thing. These codes are effective immediately for use in reporting the laboratory test for the orthopox virus and vaccine administration utilizing these vaccine products. So, for example, tomorrow if you get the code for these conditions, we need to utilize those codes. Note that these codes do not appear in CPT22 code set. However, they will be included in the CPT23 code set in the microbiology section of the pathology and laboratory section, and in the vaccine toxicides subsection of the medicine section respectively. So initially we are not going to have these codes in 2022 CPT coding book. As they told, CPT 2023 book is having all these codes. So this issue of CPT assistant specialization introduced and provides a guidance on the appropriate use of new orthopox virus testing code A7593, as well as the new vaccine product score for the JNU's combined smallpox and monkeypox vaccine 90611 and the ACAM 2000 smallpox vaccine 90622, along with use of existing vaccine administration codes. So these are vaccine code, these are administration codes 90,460, 90,461, 90,471, 90,472. That should be utilized with the new vaccine products codes. So these are the, in microbiology we have these new codes 87593 for microbiology section. Infectious agent detection by nucleic acid, DNA or RNA, orthopox virus like monkeypox virus, cowpox virus, vaccinia virus, amplified probe technique each. So if we find this in pathology section, we need to code 87593. Here we have few more codes for vaccines or toxoids. 90611, smallpox and monkeypox vaccine, attenuated vaccine virus, live, non-replicating, preservative-free, 0.5 ml doses, suspension for subcutaneous injection. So they are going to uh, use this as a subcutaneous injection. So 90622 vaccinia smallpox virus vaccine live, lyophilized 0.3 ml dosage for percutaneous use. So if anyone needs this document, please mail at fastcoded21 at the rate of gmail.com. We will send this document to your email. And here we have some examples also. We can discuss those. Clinical example for 87593. A 45-year-old male presents with skin lesions, fever, and lymphadenopathy after potential exposure to monkeypox. Swabs of skin lesions are obtained for polymerase chain reaction testing. So then in this situation we need to code 87593. One more for 90611. A 36-year-old male who is at risk for exposure to an orthopox virus, that is like monkeypox virus, presents for vaccination. So in this visit, if the patient takes a vaccination, you need to code this one 90611. Here one more example for 90622. A 36-year-old male who is at risk for exposure to orthopox virus, smallpox virus, present for vaccination. Then we need to code 90622. So this is for smallpox virus 622 and 611 for monkeypox virus. So if anyone need this document, please send your email at fastcoder21 at the rate gmail.com, so we can send this document to your inbox. Thank you guys. Thanks for watching. Hope we can utilize these codes in future like coming way. If you have any concern or update, please mention in the comment section. Happy coding guys.